At the Johns Hopkins Pediatric Esophageal Center, we treat virtually all pediatric disorders in children, ranging from the very common to the very uncommon. In infants, we manage esophageal atresia, which is a congenital birth defect in which the esophagus does not form correctly, thereby leading to an abrupt stoppage of the esophagus midway through the chest. In many of these situations, there also is an abnormal connection between the windpipe or trachea and the stomach, also referred to as a tracheoesophageal fistula. We also treat disorders of the esophagus in children who swallow things that they're not supposed to, for example, household cleaners or chemicals or button batteries, which can lead to severe and potentially life-threatening problems of the esophagus. A final category of disorders that we treat is achalasia, which is a disorder that occurs in older children and is characterized by a muscle that lines the esophagus not functioning properly. The end result is that these children can't swallow, and if left untreated, food gets stuck at the bottom of the esophagus, and they end up developing severe malnutrition as well as weight loss. At the Johns Hopkins Pediatric Esophageal Center, there are a wide range of procedures that we perform. They can range from open or traditional type procedures using large incisions, either through the chest or through the belly, to perform reconstructions for complex esophageal atresia, for esophageal replacement, to perform a procedure called posterior tracheopexy for tracheomalacia, and in cases where we need to do redo surgery, for example, when the initial esophageal atresia repair was not successful. However, we also offer minimally invasive or keyhole type approaches for reconstruction, either again through the chest or through the belly. These would include cases of more straightforward esophageal atresia or to remove masses that are in the chest, such as an esophageal duplication cyst. We can also use this keyhole approach to reconstruct the bottom of the esophagus, for example, to create a valve known as fundoplication for severe gastroesophageal reflux disease, or to cut the muscle at the bottom of the esophagus for cases of achalasia. A final category of procedures that we can perform involve incisionless and endoscopic procedures, usually using a small flexible camera that we can guide through the mouth and into the upper esophagus. We also have the luxury of having fairly innovative techniques such as the endoflip, which is a catheter-based intervention that we can place into the esophagus to get a better idea of the esophageal anatomy as well as esophageal function. Endoscopic techniques can do a variety of treatments, including stretching the esophagus using a balloon device. The Johns Hopkins Pediatric Esophageal Center is unique for many reasons. First, we are affiliated with the Johns Hopkins Children's Center, which is an innovative and nationally ranked children's hospital affiliated with a world-class clinical research infrastructure that is come to be known from the Johns Hopkins University. We also have recently established a close collaboration with our sister pediatric institution in Florida, the Johns Hopkins All Children's Hospital, which has an established airway as well as esophageal treatment program. With all of these resources, what that means is that as providers, we can stay at the forefront of the state of the art in terms of diagnosis and treatment to treat your child's esophageal problem. A second reason to choose the Johns Hopkins Pediatric Esophageal Center is our multidisciplinary approach. All of the providers within our center trained at some of the top institutions in the country and therefore have a unique skill set to bring to the table to offer an individualized treatment plan for your child-specific problems. In some cases, you may only need a pediatric thoracic surgeon such as myself, but in other cases, you may need the expertise of a pediatric ear, nose, and throat specialist or a pediatric gastrointestinal endoscopist to solve the problem. And in other cases, you may need all of these resources working together collaboratively in the operating room to solve the problem at hand. A third unique aspect of the program happens to be the fact that we are actually a children's hospital that's right next door to a world-class adult hospital. On first hand, that may not seem very obvious on why that's an advantage, but because of our close affiliation, we have many older complex esophageal patients who have chronic problems and eventually need to be transitioned to an adult surgeon or other medical provider. Due to this close collaboration, we're able to make that transition quite easily, which I think is very unique. There are very few centers regionally or nationally, quite frankly, that can ease that transition that is so needed for this difficult patient population as we can do at the Johns Hopkins Children's Center.